Bill 11, the Health Statutes Amendment Act.
Major changes to healthcare in Alberta now on the floor of the legislature. Bill 11 has 7 parts, including allowing doctors to work in the public and private systems at the same time. That should result in more options for out-of-pocket care and shorter waits for people with enough money to pay.
All day long, I would prefer to have surgeons accredited here, approved here, performing surgeries on Albertans here. I think that's better for all involved because we are responsible for aftercare.
The dual practice model, as the government calls it, would not apply to emergency or cancer surgeries. Family doctors will also stay in the public system, at least for now.
Our priority right now is to make sure that every person in Alberta is attached to a primary care provider. And so at this point in time, restricting family doctors not to provide private practice, that they would be fully within the public system, only makes sense.
The NDP has denounced the bill as for-profit, American-style health care and has demanded the government call an election over the issue.
People who can afford to pay will certainly see their wait times go down, but the rest of us will see our wait times go up unless there's way more doctors, way more anesthetists, way more nurses, way more people doing the surgeries, and there is no plan for any of that.
The government says surgeons in dual practice will still have to perform a certain number of procedures in the public system, and private surgeries may be restricted to off hours and underutilized rural sites.
She thinks those burnt-out surgeons and nurses will just work evenings and weekends. Where will the workforce come from for this scheme?
We're going to have more doctors, more surgeons coming to Alberta, and I can't wait for it.
That will be key, says this expert. The province has said it is modeling this new system after several European countries.
Some of them also have many more doctors per capita than we do. And so again, if the government is determined to forge ahead with this, they're going to need to increase the number of physicians in the province, or else people will end up waiting longer in the public system.
Bill 11 also seeks to improve food safety, add health numbers to driver's licenses, and make the province the payer of last resort on drug coverage, saving taxpayers up to $50 million a year. The government insists these changes comply with the Canada Health Act because a safety net is being maintained for people who cannot afford to pay. Experts have questioned that, however, so legal challenges may be coming. Reporting from the legislature, Sean Amato, City News.